Okay, so I promised an update. Mm, this is really the best I can do. I'm still not feeling good. It's been like 2 weeks or so since the last bout of really horrific seizures. Um, Honestly, I can't even really tell you what today is. All I know is that it's Monday. Excuse me. Um, I ended up in the hospital. I'm thinking Friday or Saturday. Um, Really, the last thing I remember before going to the hospital was standing and doing dishes. You know, normal routine that most everybody does. It's morning. You know, you've got stuff you gotta get done. I apologize for the glare on my glasses. It's my lights. Um, I and there's the paperwork from the hospital. I remember going to the hospital, but after that point, I don't remember anything else. Um, let's see. Okay, I ended up in the hospital August 26th. So today's the 28th. And that was Saturday. Excuse me again. I'm still having some issues uh, with body movements and stuff like that. Um, I I really don't know. All I know is what I've been told by the people who were with me, which was my husband and my son. And my husband told me that I'd got kind of snippy with him while I was doing the dishes. And usually for me, that's pretty much a sign of something's going to happen. So I'm trying to adjust my glasses. I apologize. Um, so I'm gonna read what the emergency room doctors told me after I tell you this. Uh, my husband says that I had a seizure that lasted probably 3-4 minutes, and then I collapsed. Um, He'd been threatening for a while to take me to the hospital, and I kept refusing and refusing and refusing because, of course, I don't like doctors. I've been through so much. I don't want to deal with any of it. So, let's just take those off because I can read without them. I may block my face. I do apologize. Uh, let's see. Okay. Uh, they highlighted everything that I was showing symptoms of. Uh, My husband also told me that I had collapsed or tried to go into a seizure twice walking up to the emergency room. So, when you go to the hospital, that's usually, especially an emergency room, they take you as a priority, and I guess they saw me because the next thing I really do have memory of is, well, it's partial memory. It hasn't all came back yet. Was him asking me if I needed a wheelchair, and at this point I couldn't speak, so of course I said no. Well, I shook my head. And then a nurse or a PA made me sit in a wheelchair. Still not being able to speak, I'm having a really, really hard time remembering exactly what happened. But they had put, let's see, of course I had to take all my jewelry out and to remove my bra. They did, this is all in the paperwork, they did a EKG, a EEG, and then checked my head for knots or anywhere that I had, if I'd hit my head somewhere. And, okay, so epilepsy does run in my family. I did not know this until about 6 years ago when it basically took over my life. So what they've got highlighted is what I'm going to read. Said epilepsy is a disorder in which a person has repeated seizures over time. A seizure is a release of abnormal electrical activity in the brain. Seizures can cause a change in attention, behavior, or the ability to remain awake and alert. In parentheses it says altered mental status. Seizures often involve uncontrollable shaking, which is what happens, convulsions. Most people with epilepsy lead normal lives. However, people with epilepsy are at increased risk of falls, accidents, and injuries. Therefore, it's important to begin treatment right away, which I have been on an epileptic treatment since I found out. I take a lot of medication, so causes. Epilepsy has many possible causes. Anything that disturbs the normal pattern of the brain cell activity can lead to seizures. This may include a head injury, birth trauma, high fever as a child. Now, I didn't know this when I was a kid. From the time I was born until I was probably 6, somewhere in there, years old, I was constantly sick. There was, I'd go to the hospital because I had strep or, something minor, and within a few days or hours really, it'd turn into pneumonia or spinal meningitis and all that fun stuff. stroke, bleeding into or around the brain, certain drugs, which they mean by street drugs, and prescribed medication. Prolonged low oxygen, such as what occurs with CPR efforts. I've never had CPR done on me. I don't do street drugs. Abnormal brain development. Um, they've really, that's one of the first things I checked. And since I write and I draw and, you know, I have a pretty high vocabulary, it's not my brain development. Certain illnesses such as meningitis, encephalitis, which is a brain infection, malaria, and other infections. An imbalance of nerve signaling chemicals, of the neurotransmitters. Signs and symptoms. The symptoms of a seizure can vary greatly from one person to another. Right before a seizure, you may have a warning, which is called an aura, that a seizure is about to occur. An aura may include the following symptoms: fear and anxiety, nausea, feeling like the room is spinning, which is also known as vertigo, vision changes such as seeing flashing lights or spots. I do all of this. Common symptoms during the seizures: abnormal sensations. I can touch something, let's say it's one of my hair bands that I hold my braids up with. I can touch this and it feels off. It's not right. There's something wrong with it. It doesn't feel right. Abnormal smell or bitter taste in mouth, which I do get both of those. Sudden general body stiffness. It mainly occurs in my upper body, which would be my hands and my neck, shoulders. Appearing to be awake but not responding. Excuse me. From what I've been told, usually during the seizures, my eyes are open, but I also have nocturnal seizures, which makes me very happy that I don't sleep on my stomach because you can smother yourself. Sudden change in consciousness, convulsions that involve rhythmic jerking of face, arm, or leg on one or both sides. It takes over my full body. Appearing to be asleep, cannot be awakened. That happens with nocturnal seizures, and those are horrific to wake up from. Grimacing, which I know I do that just because after I come around, it could take 2 to 3 days for my jaw and my face to actually stop hurting. And drooling, which, yeah. If I feel a seizure coming on, I will immediately lay down on my left side and put my elbow on my head like this. And when I come around the floor, my arm, my shirt, whatever is in the path of me is completely soaked in drool, tears, because apparently I cry during the seizures. The only thing I can say about that is seizure equals pain, and pain for me is one of my triggers. So when I seizure, I'm in pain, and when I'm in pain, I seizure. So they continue. It's a loop. Depending on how long I can deal with what's going on is how long it'll take me to go to the hospital. See the next page. This is what they want to do to me, which I've already had an MRI and a CT scan. They want to do a spinal tap. They did blood tests at the hospital to make sure there was no infection or abnormal, blood chemistry such as platelets and stuff like that being off, medications being too high, etc. And the treatment, which all of these that have X's by them are what they were telling me. There's no cure for epilepsy, but is generally treatable. Once epilepsy is diagnosed, it's important to begin treatment as soon as possible. For most people with epilepsy, seizures can be controlled with medications. The following may also be used: a pacemaker for the brain, which I've adamantly denied because when I went to see my first neurologist, he basically told me that, there's probably a 30% chance of it working, and the other 70% chance is they could mess something up and I could either die or, the way he put it is, not be able to walk and chew gum at the same time. And this is the pacemaker for the brain. It's a vagus nerve stimulator. It can be used on people who have seizures that are not controlled with medication, which, this is really the only option besides dealing with all of this that I have. Lack of sleep can cause seizures. Avoid any known triggers of your seizures. Keep a seizure diary, which I do. Record what you recall about any seizure, especially any possible trigger, minor pain, and photosensitivity. Any type of blinking lights, sirens, will set off a seizure. Stress will also set them off. And I'm basically an insomniac 95% of the time. I don't get more than 4 hours of sleep. So that's possibly one of my triggers. I don't know yet. It also says to make sure the people you live and work with know that you are prone to seizure. They should receive instructions on how to help you in general. A witness to a seizure should cushion the head and body, turn you on your side, avoid unnecessarily restraining you, and not place anything inside your mouth. If you have epilepsy, anytime that you get sick, your seizure tolerance is lowered. And with the hurricane that has moved through Texas or is still on the coastline, mine has lowered quite a bit from all the injuries that I've had, plus sinus crap going on and all that other stuff. It says seek medical care if you develop signs of infection or other illness. This might increase the risk of seizure. You seem to be having more frequent seizures. Your seizure pattern is changing. They, at this moment, have no clue what to do with me. I'm really one of the first that a lot of doctors have seen that medication does not work well on. And there's my band. But I'm sorry my hair's in my face, but it's trying to grow out a side cut is very difficult, especially when it's all the way around your head. Now, I did read back through some of the texts because I always keep a text record of, when I'm about to go into a seizure or whatever. And in one of the texts, I told my husband to either call an ambulance or take me to the hospital. One of my friends told me that she basically had finally won because I had refused so many times to go to the hospital because I figured my body could handle it, and apparently it can't. So, I guess that's really all I have to say. I just wanted to give the few subscribers that I have an update on what's been going on, and we'll see how the rest of the day goes. I have to call my PCP today and see what he's gonna do. He was actually at the hospital because he works both in the office and at the hospital, and he may be changing my medication. I don't know. It makes me very paranoid when they mess with my meds, especially since I've been on them for so long. I hate dealing with withdrawal from any type of medication, especially from Keppra, which I'm on the highest milligram of Keppra a day. and I don't know. So, I guess, there's your update. Uh, Still really sore. I'll have to ask my husband how many seizures I actually did have from 2 weeks ago when I posted my last video until now. I did sleep last night, which is amazing to me. I think I got a full 8 hours, maybe 9. I don't even remember what time I went to sleep. But it's really all I have to say. I hope that everybody has a good day and that, you watch people around you closely. Because we may look normal on the outside, but on the inside, we're not. Anybody with any type of internal issue will tell you that. My favorite thing to tell people is, especially when they ask me when I go to pick up all my medications from the pharmacy, is, well, you don't look sick. Why do you take so much medication? And I said, well, you don't look stupid, but I'm sick and you are stupid. So, anyways, I'm done talking for right now. I'm still really tired. I'm going back to sleep. Thank y'all for those who are watching. I appreciate it, and I'll continue to update as soon as I know anything else.